Everybody, Dr. Becker. I wanted to take a couple minutes with you guys today and just really quickly go through a couple things about test taking as we're getting ready to come into your first unit exam. I created a couple of fake test-like questions that I thought might be beneficial for you guys as you're thinking and preparing of what test questions could look like and kind of getting an idea of what to expect. When making test and exam questions for this course, I try to make a good number of them to be reflective of what you may see in the future, especially for like board questions. When after you graduate and you're sitting for your board certification. So I want to go through a couple and hopefully this is something you can find helpful. These are kind of made up questions here that we could talk through. Sometimes in your quiz questions, they can be more direct and straightforward, but the exam questions tend to be a fair number of them to have more of a scenario that you're working your way through. Remember, you only have 90 minutes to do your exam. They're 50 questions. So roughly, that gives you a little less than 2 minutes a question. So you do have to study, you do have to know where the material is in your notes and in the book and kind of know, oh, I read that and I can go back to that section if I need help. If people don't prepare for the exam and you try to do these questions in 90 minutes, I think it would be very tough. Okay, so you're ready to go. You get a test question like this. So a 23-year-old male patient presents with symptoms of recurrent twitching thumb, which is accompanied by nausea and flushing and a sense of fear. The symptoms come and go and last about 30 to 45 seconds. He presents to the neurology clinic with the above complaints. After obtaining an unremarkable workup, which of the following would be the best next step for the APRN? So a couple of things to consider. When you get a scenario like this, we need to kind of dissect it very quickly in your mind of kind of what the situation is. Whenever you get 23-year-old male, 77-year-old female, those details could be just absolutely nothing in a red herring that don't actually affect the question, but you have to be prepared that they could. So in my mind, when I see that it's a 23-year-old male, couple things you need to think of right away. One, it's not a pediatric patient, right? And two, it's not a geriatric patient. Why do I say that? Because if it's more towards a pediatric 17-year-old or 15-year-old, for example, maybe there's some nuances there that could affect the question. Or if it's an elderly or older adult patient, then we have to start thinking of things like the different pharmacokinetics that can happen with an older adult, like decreased liver and renal excretion and all those things. So by knowing it's a 23-year-old, you're kind of thinking, well, it's not pediatric and it's not a geriatric. Hopefully it's a nice, normal, and what I mean is a routine adult healthy patient, okay? When you know that it's male versus female, that's also can be an important thing. Sometimes it's not. Whenever you think female and you realize they're of childbearing age, always take that into consideration for any test question, whether it's pharmacology or not, because you have to then consider in the back of your mind, is pregnancy something that I need to rule out or be concerned about? Okay. Then this stem of the question goes into giving you a lot of details. So after we hear what his symptoms are, the thumb twitching, nausea, flushing, and fear, and we know that he went to neurology, what you should be able to identify in here is that what is there a syndrome or a diagnosis we should be thinking of based on these symptoms? So for this gentleman, these are very classic symptoms for partial seizures. So in your mind, having studied seizures, hopefully you go to thinking partial seizures or some kind of seizure. And so we're kind of now you have to, in order to move on to the rest of the question, you have to make a couple of decisions. So one of which is what diagnosis or condition are you most likely dealing with? Then you go into saying, it lasts 30 to 45 seconds. That also fits with a partial seizure. He's going to neurology, which also helps us fit that he's a partial seizure, a seizure complaint. Then you get these details after an unremarkable workup. So in other words, that's letting you know that he's a healthy, they didn't find anything on any workup. Which of the following would be the next best steps? And then the question goes into presenting you options for the next step. All of these are drugs. So you know that the next step is asking you essentially what would be the best first treatment for a 23-year-old male patient who has a diagnosis now of partial seizures. And so now you would need to know that algorithm or the chart or the table in your head. You've either memorized it or perhaps you're ready to go back to your book and see what the table said. Okay, so now if you go to your text or your notes and you go to say what would be a good drug of choice for partial seizures, I can tell you it's valproic acid. Ethosuximide is actually not one of the drugs that you would ever use for a partial seizure. Through your reading, you would find out gabapentin is not going to be first line of choice. Whenever a question asks you what's the best next step, that's your key to let you know that perhaps there's more than one that could be possible, but we are talking about what would be the best next step, meaning that the first step or what, you start with this and then like first line options. So gabapentin is not something that's a first line option for treatment of seizures. And then you would not treat this patient with only clonazepam as a barbiturate or a benzodiazepine for treatment of partial seizures. So in the space of about a minute and a half, you have to be able to dissect, okay? Some of these questions are complex because you're not going to be able to answer this until you make your way through kind of this decision tree of everything you have up here, okay? So let's do this again, a different way. So this one says the same thing. It's the same scenario, all of the above. The difference is that when you get to here, it says, which of the following would be the best next step for the APRN? You'll notice the difference from this question up here was that question above that we saw, thus after obtaining an unremarkable workup, okay? But let's say this is how the question read. Which of the following would be the best next step for the APRN? Now we have different kind of answers. So when you look at these options for your answers here as a multiple choice, we're not just looking at drugs, okay? So it's the same thing. You would need to notice it's a 23-year-old male, be thinking what that could mean. You still have to know the symptoms of the diagnosis or condition that you're likely treating and that you're at a neurology clinic. These are all clues within the stem of the question. And then the best next step, again, is going to be telling you which one of these is the best, meaning they all could maybe sound reasonable, but which one is the most appropriate first next step to take based on what you know in this question. So now we have obtain baseline labs and EEG, complete a thorough history and physical exam, complete a thorough history and physical exam and order a CBC and a urinalysis, obtain baseline labs and an MRI of the brain, or refer to psychiatry, okay? If you were prepared and you've done some of your studying and you go to this section on what you do next, we know that we need baseline labs and an EEG and our complete history and physical. So now this is your next best step for this scenario. Whereas up here, we were already told that the workup was unremarkable. So now we have that information. Our next best step would be the choice of the drug. These other ones seem fairly reasonable, but nothing in your reading is going to tell you specifically this drug or people with partial seizures need a urinalysis. That doesn't make any sense. Then you can go to obtain a baseline lab and an MRI. Well, that could be part of the workup. They do talk about that in your reading, but it's not the best next step. And it didn't obtain the history and physical. Almost always as a hack when you're doing questions, it's just like, they tell you the ABCs are important. Almost always, if you have an option to get a complete, thorough history and physical, that probably is part of the answer. And then refer to psychiatry. Well, sure, at some point, maybe they do all of this and they realize that, but the best next step is not going to be just to refer them to a different specialist, okay? And you're not going to find that in your reading. So I give these two as examples because they're very similar, almost identical scenarios, but your keywords in your STEM are different and what we're asking is different, okay? Let's do another example. A 23-year-old male patient presents with symptoms consistent with partial seizures and was started on valproic acid by neurology. He has been taking the valproic acid for the last 7 weeks and has not had resolution of his symptoms. He presents to neurology for follow-up today. Which of the following is the best next intervention by the APRN for this patient? Okay, same thing, you would immediately think 23 years old, they're not pediatric, they're not geriatric, it's a male, I'm not worried about pregnancy. I already know his condition is partial seizures and that he was started on valproic acid by neurology, and you would know from your preparation that this is an appropriate thing. And then you're going to go to your book and say, or you already know this, right? So he's been taking the valproic acid for the last 7 weeks and has not had a resolution of his symptoms. So he's been started on the appropriate drug, but it's not completely resolving his symptoms. What's going to be our next best step? When we get to our options here, we have A, check labs, obtain valproic acid drug level, and increase the dose as needed. B, stop the valproic acid and switch to phenytoin. C, question the patient about his compliance with taking the valproic acid, as the medications typically control symptoms by 4 to 6 weeks. Or repeat EEG to see if the diagnosis of the partial seizure is correct. Okay, per your reading, you would know the answer is A, that you should check labs to see, make sure their creatinine, their liver, all of those functions are normal, and check the drug level. And then you would increase doses as needed, because it talks about this in your book, that you would, sometimes you need multiple levels or drug increases to happen before you would switch drugs. So stopping the valproic acid automatically and switching to phenytoin would not be the right thing in this without knowing this information. Question the patient about his compliance. Well, that could be one that's kind of a good red herring, but the book specifically talks about you would need to increase doses. And then repeat the EEG to see if the diagnosis, and that is partially true. But again, we said the best next step. So that goes back to the stem of the question, which is telling you that he's been taking it for 7 weeks and has not had resolution. What is the next step? Honestly, the steps in order probably for this patient would be, first, you're going to check this. Then, if these are abnormal, maybe you do have to question this, right? And then maybe you would stop and change potentially whatever. So even though all of these 4 answers here, if really in your mind, you could get really caught up in it and argue that maybe all of these are right or possible that you could do for this patient. But remember, we're asking what is the next best intervention. So I hope you guys find that helpful, just kind of an idea to think about ahead of time as you're preparing for things for your test. And when you do get your first exam, to kind of give you a thought process of how to tackle some of the questions you may see. As always, please reach out if you have any questions. Thanks.